What's up, world? My name is Zavian Dre, and this is my podcast, Dopenly Honest, breaking the chains of addiction. What's up, guys? Welcome to another episode of Dopenly Honest. On today's episode, we are diving deep with someone who is very special to me. This person has played a very crucial role in my recovery. Angie Chisholm is a nurse-midwife who has expertise in working with women in recovery. She is more than family to me. She's been there for me during some of the darkest times of my life. So let's not waste no time. Let's get straight to it. Welcome to another episode of Dopenly Honest. Angie, I want to thank you for your time today. And if you don't mind, to just introduce yourself and tell us about your background personally and from a professional point of view, if you don't mind.
Well, first off, thanks for having me here. I'm really excited to do this episode with you. I would like to start off by saying I'm from Kentucky. I grew up here right in Shelbyville. And I got interested in working with people in recovery because of my own personal life experiences. Addiction has been something that's been a part of my life since as early as I can remember. People that I loved, family members, friends of family, struggled with things like cocaine use, alcohol use. And as a child, I remember trying to figure that out, and I even remember trying to solve the problem as a kid. And as I got to working professionally, my first degree was in social work or human services, but I wanted to work with families. I think I learned from those early life experiences that there were things like generational trauma. I don't think I had the language for that at the time, but people experience traumas and then, and also just the trauma of living in poverty. And it gets passed down through kind of like mindset. It gets passed down through a family. And that was something that I remember interesting me as I started off my career. Again, like I said, kind of working in more of that social work area. But I fell in love with becoming a midwife because I was thinking that if you're going to transform families, finding them when they're starting their families is really a pivotal time to bring about change. And so I kind of transitioned from that social work area into working with pregnancy and childbirth. And throughout my career as a midwife, and I've been a midwife since 2009, but I have had the privilege of working quite closely with women in recovery. It's not been the only thing I've done, but it's been a part of my career, like a thread through my career, both as a midwife and then as a nurse. Before I was a midwife, I worked in acute detox settings, and I also worked in a federally qualified health center, and then in residential drug and alcohol treatment for pregnant and postpartum women. And then most recently, I worked at the University of Kentucky in their midwifery clinic, but also in a program called Pathways. And in that program, we specifically worked with pregnant women and provided prenatal and also support services for recovery, all under one roof. And then we kept those same women in the program for a year postpartum to help prevent overdose deaths.
You mentioned working with women that are pregnant and in recovery. If you don't mind to just get a little bit more into detail about how you work with them. I think you mentioned also some of them may be on MAT as well, which is medically assisted treatment, and Suboxone or methadone and things of that nature. If you don't mind, if you could get into detail a little bit more about that.
Yeah, I'd be happy to. Well, one thing I just want to point out is not everybody's aware of this, but the United States has one of the highest maternal death rates in all of the industrialized world. So when we compare ourselves to many countries even countries that have more poverty than us and less resources, we're not doing as well as they are when it comes to maternal outcomes. Knowing that, we have to look at what is driving the deaths of mothers in the United States. And when we think about pregnancy-related deaths, it's any death that occurs in pregnancy or in the year postpartum, so the year after they deliver. And the number one cause of maternal death in the United States is actually overdose-related deaths. And we know that people are more likely to die of an overdose in the postpartum period, and most postpartum care ends at 6 weeks. So at 6 weeks, you're not really getting any further care most of the time. And with that, people fall through the cracks and they're not getting the help that they need. And it's already a stressful time, because you're a father. Postpartum is stressful for couples. It's stressful for moms. And if you also are dealing with recovery on top of that, it can be especially hard. So we know that 80% of the deaths that do occur are preventable, which I find an astounding number. It's just super sad to think about somebody not having a mother for something that's preventable.
So with me and what I've seen in recovery and different women that have been, because I've been to multiple treatments and I've seen multiple women that are pregnant and they are on MAT or medically assisted treatment. And I know there's a stigma. A lot of people think that the woman being pregnant with child and being on MAT, that when the baby is born, that the baby will become addicted. What is your medical or professional point of view on that?
Well, I want to start with answering your question about are babies born addicted, because this is a really common misconception. Babies whose mothers use medication for opiate use disorder in pregnancy are not born addicted. They may have some physical dependence that when they are born, they may have symptoms that could include things like high-pitched crying, trouble sleeping, irritability. And I think a lot of onlookers or nurses or parents look at that and say, oh, that's a withdrawal and that's because they're addicted. But actually, it's just a physical symptom that can be treated. And once that goes away, it's not leading them to be, more at risk for addiction. Essentially, if you think about it, in pregnancy, sometimes babies are exposed to other medications, medication like antidepressants, for instance. And when they're used to getting that throughout the pregnancy, afterwards, they can have some symptoms that look really similar as their body adjusts to not having that medication anymore. Or in the cases of gestational diabetes, because the mom has extra blood sugar in her system related to diabetes, the baby could also have extra blood sugar. And then once they're born, they're not exposed to that same level of sugar. And so they could have low blood sugar episodes. So there's always an adjustment that happens when a baby's born from what they were exposed to in the pregnancy to what they have going on now. The good news is that if moms are exposed to opiate medication like Suboxone or methadone in pregnancy, that their providers are anticipating that baby could have some of these symptoms, and not all babies do. But if they do have those symptoms that we talked about, tremors or high-pitched crying, trouble sleeping, irritability, we call that neonatal opiate withdrawal syndrome. And if babies are expressing those symptoms, then parents can do the normal comfort things that they would do anyway for most babies. And that can include holding them, placing them in skin-to-skin direct contact, breastfeeding, and essentially keeping the room dim and light or dimly lit. But those comfort measures, medically, we refer to it as eat, sleep, console. So you're just providing baby with normal comfort, and that is enough most of the time. In some instances, babies may need to take medication to help with those symptoms, but they still are temporary and over the first few weeks will resolve. Now, I would like to also go back and address your comment about stigma and medication for opiate use disorder in pregnancy. When I was kind of setting it up, telling you about how serious the problem of overdose deaths is, that's my number one agenda, is everybody should be able to have a mom that's living and caring for them. So we need to prevent people from dying unnecessarily. And one of the ways that we can prevent that is through, you call it medication assisted treatment, and some people refer to it as medication for opiate use disorder, or MOUD. And both of those, phrases can be used interchangeably. But most of the things like Suboxone and methadone are used with people who have opiate use disorder. There's not as reliable treatment for people who are addicted to things like cocaine or methamphetamine, as far as, helping prevent them from having a bad outcome. But I think that those medications are life-saving. And some of the deaths that I've seen occur for pregnant women have occurred in people who have not wanted to use those medications because of the stigma. So I do think it should be a part of the recovery conversation, that whatever it takes for people to get healthy, sometimes people need medication and it may be a temporary thing for them. And some people need to be on it long term, but some people need that so that their brain can change and that they have the capacity to engage in recovery services. But when somebody is living with the kind of brain that's been affected by opiate use or other substance use, they often need help before they can engage in recovery.
Yeah, I agree. And I'm going to go off of what you were just saying about some people, their path and whatever it takes.
Mhm.
You said whatever it takes. And for me personally, I've been on MATs in my recovery journey, and I'm not going to shy away from talking about it. Everybody's recovery is different. But when we talk about recovery, a lot of people get the misconception that it's just the not using part. Real recovery comes in when we change spiritually, when we get a spiritual change, a spiritual awakening, as they call it. There is a misconception. A lot of people in the programs frown upon MATs. Likewise, a lot of people in the programs, when I say programs, I mean Narcotics Anonymous, Alcoholics Anonymous, or what have you, Celebrate Recovery. It's kind of a mixed crowd. Some of them frown upon it, some of them openly accept it. I'm for change, and I'm for whatever is helping someone get better. Now, when we talk about MATs and medically assisted treatment, or medicals for opiate use disorder, they're meant to be tools used in early recovery, meaning when somebody's trying to get off of opiates, the MAT, the methadone, the Suboxone is meant for short-term use to get the person transition from going from that, the hardcore opiate, which is the fentanyl or oxycodone or whatever opiate that they was on. And the medically assisted treatment is used for pretty much just as a tool, like a stepping stone, so to speak. And I can speak on that because it is, like I said, it's helped me before. And it helps someone to be able to get their mind and their brain stabilized. And if that tool is used properly, I recommend somebody to just do cold turkey. But realistically, everybody can't detox cold turkey. I've met people that have. I have, even in the past. At this past time, MAT has helped me personally. We can get into a whole conversation about detoxing off of opiates. I know opiates was my point of view, and I know personally you've helped me detox a few times. If you want to tell the people, and I do want to also say this, is that the few times that you've helped me detox were my easiest detoxes, so to speak. So if you can tell the people about the stuff that you used, the medicines that you used on me when I did those cold turkey detoxes.
One thing I want to start with is, in general, I don't recommend people detox cold turkey or, try to quit cold turkey. They do need to have some medical help, because there are with opiates specifically, there are real physical changes, as you know way better than I do. There are real physical symptoms that people have. And if you're not addressing those, then you can get really sick. Whenever I worked with you and you were wanting to detox, and when people, the reality is some people need to stop and they don't have the support services available to them. It may be lack of insurance. It may be they can't get away from work. In reality, for women, there's a lot of stigma in admitting that they have a problem and fear of child welfare services. So people are out there trying to detox and maybe without the appropriate help. But what I can tell you is that even basic over-the-counter medications can help. So things like ibuprofen help with body aches. Antidiarrheal medications like Imodium can help with diarrhea. Hydrating really well. So having like Pedialyte or Gatorade, something to keep your electrolytes up, that can make a difference. Certain supplementation that you can also find over the counter, like an amino acid formula, which really supports brain health. So there are things like L-theanine and GABA and L-tyrosine that help with the mood changes that come along with detox. So that just kind of lifts your spirits a little bit, but you can get that in an amino acid formula. And then things like magnesium, taking that a few times a day can help with anxiety. So there are a lot of support things that you can readily find over the counter that help with acute detox. In an ideal world, nobody would be trying to do that alone. They would have some support available to them medically. But I recognize that sometimes people have to. They don't have any other choice.
Yeah, I know, like, for example, when we were in Lexington, well, the first time I went out, when you were staying in Oregon, I had went out there, and I know you had me on multiple medications, some over the counter. I think you may have mixed in CBD, which that helped, that did help too. And then the time in Lexington, this last time in Lexington was a real easy. Now, I'm not going to say that it was pleasant, but with me and my personal experience with detox from opiates, the number one thing, the number one killer, and if you're listening, if you've been on opiates, you're gonna agree is the restless legs. So when you go from using fentanyl every day and then, or whatever opiate, and then you stop, or you run out, or you don't have a connection, or whatever the case may be, the first day, you're going to experience some discomfort. The second day is when it's really going to start to kick in with the sweats. You're going to feel hot and cold at the same time. You're not going to be able to sleep. The main things that I feel like if you could treat a little bit that would ease a detox would be the restless legs and the sleeping, because with my personal experience and when I was detoxing, like I would go 2 or 3 or 4 days without sleep. And then once you get to that level of that long of not sleeping, then you start to experience like some psychological effects as well. So the people that you've worked with in recovery, do they often are like the pregnant women? How does it affect them?
Well, that brings me back to that topic about, medication for opiate use disorder specifically. In pregnant women, we don't want them to detox. Detoxing in pregnancy is one of the big causes of complications. So what we're trying to do is stabilize people who are pregnant. And the way we stabilize them is by offering them medication. And if you think about it, really, the risk of using opiates in pregnancy is related to the big surges and then the crashes and then the surges again. So when you're out there and you're kind of living that lifestyle, as you would say, you might have a plug, get what you need, and sometimes you have no control over how much you're getting the dose or anything. You just get what you get. And then you might go a day or so and not have any. And then you might get some more, could be any random dose again. And those kind of big surges up and down is really what puts a pregnant person at risk and potentially puts the baby at risk as well. But when we're able to give opiates at a standard dose and provide it to them throughout the pregnancy at that stable dose, that really reduces a lot of the risk
Is that a thing for like the safety of the child as well?
for both. And so the recommendation from like our organization, so I'm a nurse midwife, and so my organization is the American College of Nurse Midwives. But then for obstetricians and gynecologists, their organization ACOG, they both recommend, and so does the addiction medicine organizations too. They recommend keeping people on medication through the course of their pregnancy and not detoxing them.
Okay.
So that's what we try to do. There are people, and this is a shared decision making thing. There are people who are just like, I'm not comfortable with that. I really want to not be on opiates in my pregnancy. And that's a decision, that they make. And we would try to encourage them, if that's their decision, to wean from that and not go, from whatever random doses that they're taking to being completely, off of it altogether, but to kind of wean down if that was their choice.
Okay, so what's the alternatives like for, let's say, for a woman who is on Suboxone, for example, or if they've been using and they don't want to continue to use anything else, or MAT, what are some alternatives like? Because I know there's a lot of risk associated with that. Like, is there any alternatives like as far as medicine, or like is there something else that's like a different route that y'all can go down?
Well, typically, what's recommended in pregnancy for opiate use disorder is going to be Suboxone or, things like methadone, kind of whatever if they were already started on something, we would kind of keep them on the same medication. It used to be that we would give Subutex, but now you're seeing more and more providers have moved to Suboxone instead. But as far as alternatives, like let's say they decide they don't want to be on an opiate, then treating sometimes the underlying mental health, that could be contributing, that can be helpful, providing therapy and support. I think regardless of whether people want to be on medication, they should have a recovery support system. And they really need a provider, an OB or a midwife, who is able to be with them in their recovery and is approaching it from more of a wraparound or holistic type of care. Versus, I think what's happening in a lot of places is they're going into this provider for their pregnancy to get their prenatal care, who doesn't really know anything about recovery, and they may have their own biases and beliefs about people who are in recovery and not really support them in the ways that they need. We're lucky in Kentucky, there are a few programs that are that more wraparound services like Pathways at UK. There's the MOUD program in Louisville. So we do have some options for that. But what people really need is to be engaged in care. And I think a lot of pregnant women who are suffering from substance use disorder, they're avoiding care because they're afraid of losing, custody of their baby ultimately. But the earlier you can get enrolled in care and the more support you can get, the more likely you're going to be able to keep your baby and long-term be a good parent.
Yeah, I think a lot of people, whether it's a woman that's pregnant in recovery or whether it's just your average person, I feel like they want to treat the drug use. And I'm saying that because you mentioned treating the underlying issues. A lot of people feel like that it's going to solve their problem just to stop. And I think that's a misconception. I think that, the most important thing, we got to get to the bottom of why this individual is using in the first place. And I think if you're listening, I think that could be a good start. I think if you have like for me personally, I had some trauma and I had some I didn't have a terrible childhood, but there are some things like some underlying issues, I'm going to say, that made me start. And I think once we can figure out those underlying issues and treat those from a mental aspect, I think that's a good start in the right direction. But a lot of people just think that if they stop the use of drugs, then their problem's going to be solved, and that they just don't realize that addiction or alcoholism is a mental disease. It's definitely a mental thing. So I think once we can figure out, what we're running from, I think that'll be a good start. What's your views on that?
I agree with you 100% on that. And I have said this over and over again. Nobody wakes up one day and says, I think I'm going to get addicted to drugs. There is a lifetime of buildup that happens. And so far, I've never worked with a client or a patient who has said they don't have any trauma. Trauma is the basis of substance use disorder for most people. Now, some people they may not feel like their trauma is that bad or, that worthy of this, situation that they're in. But I think if we really examine it, it's not just the traumatic things that happen, but it's the things that we learn within our families of not talking about our problems or not having ways to communicate. And when we have substance use disorder, in my mind, it is a symptom. It's a symptom of bigger problems. It's not just taking the substance away doesn't mean that your problems go away. The substance use was never the problem. It's just a way that a person learns to cope with the pain that they have. And if they can learn to cope in different ways, if they get support for just being a human and communicating effectively with people and recognizing when they get triggered by something and working through it, they don't need the substances anymore. But quite often people don't get to that place. So I love that you brought that up.
Maybe I should have asked this question a little earlier on in the interview, but is there a particular thing like that happened that started your interest in recovery?
Well, like I said, I think some of it just started off by growing up in a community and a family where a lot of people that I loved, struggled with substance use or alcoholism. And I think just my natural curiosity to try and figure that out and to understand it, because the world wants to paint people with substance use disorder as bad people, as moral failures, or that kind of thing. But that's not correct. And it wasn't my experience. And I knew it even as a kid that some of the people I loved the most and who helped me be the person I am the most also struggled with substance use. And so I think that really drove me from a young age to want to figure it out as much as I could. And then when I had the opportunity to work with people professionally, it just reinforced that belief that I had. I still haven't figured it out. I wish somebody would, but I think we're onto something. And I see the world shifting and changing because a lot of the programs for recovery in the past were very like shame focused and very focused on just personal accountability alone. And there's certainly room for personal accountability for all of us, whether we have, substance use issue or not. But that's not the whole story. It's like you said, you have to learn the skills to live life. You have to be in relationships that are healthy. And all of that is just something that doesn't come easily if it's never been modeled to you.
Yeah, I want to get like into detail about the addiction, just the whole aspect of it, and going into it with the opiates, because I think a lot of what drives a lot of people to continue to use opiates it is the withdrawal and the detox. And I think what you got going on, you've talked to me about the ebook that you want to get into and talking about, particular medications to help people or to help people come off of opiates. Personally, for me, it wasn't the alcohol for me. I did drink, and when I did drink, I drank to not to just socially use, but to get drunk. But the main thing for me was the opiates. So I'm looking forward to that. And I think with the detox, I think that there's a lot that can be said about it to help people out because I think there's a lot of people, let's say, for example, somebody's mom or somebody's dad, or a lot of people don't understand that aspect of it. They just see that their child is, they can't, they're getting high and they can't stop, but they don't know that their body and their mind side by side are forcing them to want to try to get another one. So I know, like, you have helped me in tremendous ways. I know you've guided me through meditations. So you've helped me from a spiritual aspect. And I think that's more or less what you have a calling and a passion to help people. So that's why I wanted you to come on here just to give your side of things, and from a professional point of view and from just, from experience, because I know you work with a lot of addicts and people in recovery. I wanted to get into this, like, so with the patients that you work with, do you feel like that it's going down, or are you seeing a spike in women in drug abuse, or is it coming down since you've been in the field?
If you look at the numbers, we see that it is going down for some people. Specifically, if we bring race into the picture, we see that overdose deaths for Black women are actually going up, whereas overdose deaths for white women are going down. And some of that, we can look at, and you might be a little bit too young for this, but I was alive during the times that we had like a crack epidemic in the US. And with that epidemic, it was more focused on the African American community in the US. But when we were addressing that problem, it was a situation where there was more blame for the people who were experiencing addiction and more criminalization of their behaviors. But when places like small towns all across Kentucky started having women dying of overdose, and a lot of them were white, there was a change in how people viewed addiction and how there was a shift to, hey, let's try to save lives. And it's unfortunate that we have to break it down that way, but I think that is a reality that we've put a lot of efforts in building programs, but a lot of the programs are serving disproportionately, white people in recovery and not really including everybody that needs it.
Yeah, so why do you think that is? Like, why do you think that the overdose, you said in particular in African American women are spiking, but in the Caucasian women are going down? Why do you, like, personally, why do you think that that is?
Well, I think that a lot of the programs that are out there are really open to everybody, but for various reasons, I think Black women are less likely to trust that that's a safe place for them to go and get help. And it can be because they fear, that they are going to be criminalized or that their babies are going to be, taken away from them if they admit that they have a problem with substance use. And so they may avoid getting health care. And then ultimately, at the end of their pregnancy, they're going to show up at the ER and they may go through the trauma of losing custody of their baby. And then after that, they may have some, depression, anxiety, suicidal, kinds of things that happen. So that is something that we see, like a pattern that we see, that it's not just with substance use, but it's even like with mental health problems. Like if you are a middle class professional person who happens to be also white, for instance, and you go in and you get a screener in the office that says, oh, I'm having postpartum depression, you might feel safe talking to the provider about it and asking what kind of resources are available. But we don't see the same kind of engagement in people who are lower income or, just typically marginalized communities, including for Black women. They may not feel like they can be honest because they're worried that people are going to say they're not fit to care for their baby. So that prevents them from accessing the care they need to ultimately to prevent that overdose.
And in your profession, are you seeing more of addiction and alcoholism targeting young people, middle-aged people, or people that are a lot older, like 50s and up?
I think it affects everybody. I do think we've made good progress, in the past few years, but there was a time where we were seeing older people, and maybe I don't work with them as much because my career has been more focused on pregnancy and postpartum. But you do have people that, didn't really have a problem, but went in for a shoulder surgery or knee surgery or something, and they did end up physically getting dependent on these medications, which looks a whole lot like just being addicted to, opiates. So you see that. I think there's more awareness and less prescribing. There was a few years where prescribing was just way out of hand, and you go in for a little thing and you come home with like 2 bottles of narcotics. And now it's very controlled. I mean, even in my career as a midwife, like if somebody had a C-section, we used to send them home with a certain amount of opiates, but now it's very limited to just a few days worth of opiates. So those prescribing changes have prevented some of the addiction that's happened.
Okay. I wanted to talk some about, I wanted to just get into more about my visit with you in Oregon. So, around that time in my life, I was in the middle of my heroin addiction, and I had tried everything, So, in the last effort, my mom wanted to ship me out there with y'all. And I would like to say that was the last time I used, but it wasn't. And I know that one night you had took me to Portland because I was gonna go to the strip club just for recreation. And I just wanted to speak on, the geographical change. A lot of addicts, we try to find different ways to get clean. One of those is a geographical change. But what we fail to realize is that wherever we go, we take us with us. We take our mind with us, our thoughts with us. So we don't just take our body with us, we take our mind. And in addiction and alcoholism, that's the number one thing that we battle with is ourself and in our mind. So when I got there, I had already been drinking too. I'm not gonna forget that. I had already been drinking. So long story short, I still managed to find someone with drugs. That geographical thing, a lot of people think they can just go to try, and I have known people that has worked for. But I say that to say that we just have to get to the bottom of why we feel the need to put a poison into our system because it's insane behavior. For the longest, I didn't know, I was just trying to, I was just running for the longest. Like I said, I would like for that to be my last time using, but it wasn't. But I think it planted a seed for me because when I went out there, like I seen different things. I seen that there was more to life than just right here in Kentucky and Shelbyville, it opened my eyes to some things. So I just say that to the addict who's still listening. It's important that you try to get to the bottom of if you have trauma or any reason that you feel that is driving you to continue to use. I feel like that it is essential for you to get to the bottom of it because no matter how many times I always say the easy part is to stop the use of drugs. And that may sound insane, but it's the truth. That's the easy part. Then the hardest part is to figure out how to live after you stop the use of drugs. So, Angie, at the end of these episodes, I try to ask my guests if there's one piece of advice that you could give them to try to turn their life around, what would that be?
Well, I think the most important thing that people need to know is that they are valuable, that their life means something, that they have so much potential in the world. No matter what you've been through, it's still worth it to try, to be your true self. I think that is the beauty of working with people in recovery is when you get to know who somebody truly is. Because when you're living in addiction, you're not being yourself. You're really kind of being, you're just living day to day, surviving and trying to stay, alive, basically. But you're not engaged with the world and you're not yourself the way that the world needs you to be. And that's what I think people need to know is they're important, they're valuable, and I'll end it on that.
I would agree. I just want to, go off of that and say, man, just reach out. You are valuable. As Angie just said, you are valuable. You are still alive for a reason. There's been many times that You could have overdosed and that would could have been your last time using or your last day on earth, man. So just take it from me, somebody that has really been through the cycle of addiction and alcoholism, that there is a better way of life. There is a better way. So with that, Angie, I want to thank you for coming on to my platform that you helped me create, by the way. And I can't put into words how thankful I am. For the longest, I've been trying to get an outlet to speak on the things that I've been through and to speak on trying to help people. And this platform has given me that. So I want to thank you, and I want to thank Russ and Bio Productions for helping me put this together. I'm looking forward to having you back because I know we got plenty of more to talk about. So with that, guys, continue to like, share, subscribe, and keep coming back for more recovery related content. I love y'all. Peace. Thank you for listening to this episode of Dopenly Honest. I know all too well that recovery is an uphill battle, but there is hope. For resources, find your local NA, AA, or CR meeting. I can't stress enough how crucial meetings are to my personal recovery. If you enjoyed this content, please like, share, and meet us back right here for more episodes of Dopenly Honest. And remember, you are not alone. One day at a time, we do recover.